Hello everyone, and welcome to Unit 6, or Learning Module number 6. So you're beginning by watching this video, and for this week we're going to be talking about complementary and alternative approaches used in chronic illness. And we're also going to be continuing on with our mindfulness and specifically mindful self-care. So I think it's going to be a chapter 5, that you enjoy and find helpful for yourself. So by the end of the learning module, you're going to be able to reflect on your own body's needs and apply self-care strategies while you're at work or at home. And you're going to, this is, number 2 is more of an optional. You're going to be able to locate mindfulness meditation opportunities in the Erie area, as well as some free apps. You're going to look at the VA's whole health program for those with chronic illness, such as chronic pain, mostly diabetes and addictions. We're going to discover acupuncture. So acupuncture is the use of needles. It's a traditional Chinese medicine approach, and the VA has used this in battlefield acupuncture for veterans with chronic pain. We're also going to talk about acupressure. So please make sure you realize that there's a difference. So acupuncture is mostly physician utilized with special training, certification, and it includes the use of needles. Acupressure can be used in nursing practice. There's still a certification process and a training process, but it's putting pressure on not using needles. So we'll go into that just a little bit more in a minute. But we're going to analyze whether we feel that acupressure can be utilized and is effective in nursing practice. And we're going to become familiar with at least one common acupressure point for chronic illness. So you're going to start by reading Chapter 5, and then we have a number of either articles or mostly web pages or videos to watch this week. You're going to take Quiz 6, which is based on Chapter 5. And don't forget, your herbal presentation is also due at the end of this unit. So after reading Chapter 5, you might want to go right into the quiz. And you do actually have 2 attempts to complete this quiz, and it is not timed. So if you're not happy with doing it at once, you can submit a second attempt, and I will grade the second one. So the first one, that assignment or learning activity for the week, is a better way to put it. It is a learning activity. You're going to watch this video about the Veterans Administration's National Whole Health Program. And we're really fortunate here in Erie, as the Erie VA was a flagship hospital for this whole health program. That means they rolled it out as one of the first hospitals within the VA system. So they've been using it for a number of years now, and I've had the good pleasure of being able to go over to the VA and actually sit through their training, etc. And it is truly an integrative health approach. So please take a moment to watch this video. I ask that you stop. It's around the 3-minute point that you're going to look at the wheel or the circle of health, and take a few minutes to look at that and really digest the wheel or the circle of health. I think you'll find it very informative. The next is at the National Centers for Complementary and Integrative Health, the website of the National Cancer Institute, and it goes over acupuncture, the use of needles, pretty much in depth. And just so you can get an idea on acupuncture. And then there's another great video on battlefield acupuncture. And again, this is used at the VA and it's self-explanatory. But I do want you to know that along with acupuncture, the VA has started training nurses, their nurses, in a certification program for battlefield acupressure. So it's still using the ear. It's auricular is what it's called. And I don't know if you can see this, but there's little strips with little beads. They call them the ear seeds. And there's a lot of training that is required for good placement. And you put those, they have adhesive on the back, and you put them on the ear in certain areas of the ear. And this allows nurses to do battlefield acupressure. And what's neat about that is then the patient can go home and actually massage those, what again is called ear seeds, those points of pressure on their ears, and can do self-care for decreasing pain. I was fortunate enough again to have the opportunity to, they're vacuuming in the background, to have the opportunity to go for this training. So, but the training is just one part. It is a certification program at the VA, so nurses have to, demonstrate competency and actually do a certain number of applications and training of patients. Wonderful, wonderful non-medical, pharmacological treatment, especially for chronic pain. So it started with the acupuncture, and now it's transitioned to acupressure, and it enhances the patient's ability to participate in their own pain management. And some patients aren't comfortable with the needles, so this increases the number of patients that are willing to do this. And it also increases the number of trained providers who can offer this fantastic approach. So as I transition to acupressure, here's two more sites about acupressure for beginners. It's the UCLA for Health site, and an article about incorporating acupressure, again, acupressure into nursing practice. So our week 6 discussion board will ask you, after reading these sources and reviewing the videos, what do you believe as far as, are you open to practicing acupressure on yourself? If so, please define what site you are most interested in and why. And then also, would you be open to using acupressure on patients, of course, with their permission? Why or why not? And which sites do you feel that patients would benefit most from? So that's our discussion board, and we end with you submitting your herbal presentation. So I hope you have a great week. I hope, and it sounds as if many of you are really enjoying the Mindful Nurse, our textbook for this course. And remember, in order to teach some of these integrative health modalities, including mindfulness, we often need to experience, if we can, and apply the strategies that we're learning. So this is a course, not a clinical course, it's a course, but yet you're doing application of much of the information that we're learning as we go along. So have a great week, and as always, remember I have office hours, and I'd be glad to meet with you on Zoom or face-to-face. Just let me know what's going to work for you. Thanks.